I'm Melissa Burdi, the Dean and Vice President for the School of Nursing at Purdue Global. So the U.S. Preventive Services Task Force, which is a group of healthcare professionals that look at data, look at emerging evidence to help formulate and shape protocols and guidelines in healthcare, with new findings and new research, have determined that the parameters for breast cancer detection should be shifted. So now women ages 40 to 74 should seek mammograms biennially or every other year as a best practice. And this is really important because nearly 13% of women across the globe are diagnosed with breast cancer at some point in their lives. And while 13% may not seem like a significant number, this actually translates into about 1 in every 8 women. So when you think about those numbers, that could be women within your household, your communities, et cetera. And so this is a positive change in the right direction that really promotes early detection. The task force recommended now biennial screenings for breast cancer, and those screenings consist of mammogram detection, which essentially is an X-ray of your breast, looking for any spots within the breast, any changes that may indicate that there could be cancer present in the breast. So having those regular routine screenings is really important to be able to look at that imaging and make those determinations. Some women have what's called dense breast tissue. And so with dense breast tissue, it requires additional examination. But if you don't know you have dense breast tissue, you'll never know that you need that additional examination to really determine whether or not there could be any type of cancer present. But routine screenings consist of mammograms, where it's an X-ray of the breast. If someone has a question or they notice a change, it's very important that they speak with their healthcare provider immediately. Do not wait. Many of us will push things off and say, I'll give it another month, I'll keep my eye on it. It is very important that you act quickly because time can save your life. And so have that conversation with your healthcare provider. Be cognizant of any change that you might see, whether it is pain at the site of your breast, if there's a lump, if there's dimpling. Very important that you keep a vigilant eye on that and that you engage with your healthcare provider as soon as possible. I think that it's absolutely warranted for this change with the U.S. Preventive Services Task Force. It aligns with the American Cancer Society, with the FDA, with the National Cancer Institute, and certainly aligns with healthcare providers and their suggested best practice around routine, proactive breast cancer screening. So I'm really pleased to see this change go into effect. I hope that women between the ages of 40 and 74 will heed this advice. If you haven't already had a mammogram and you fall within this age range, do seek guidance from your healthcare provider immediately. And I think that just engaging in that routine healthcare practice is so very important so that we can prevent and save lives.